Good afternoon. My name is student Dr. Brent Fowler. I have a case presentation over cadmium poisoning. Today I'm going to start out by discussing my case, then I'll transition into the effects of cadmium toxicity on the body and treatment options for my patient. Then I will end with ethical issues that pertain to the case. Ray, a 45-year-old African-American male, presents to the ward with a chief complaint of periodic dyspnea and fatigue. He reports occasional dizziness with no syncope, but he does have proximal generalized weakness, no orthopnea. The patient's history includes a 10-year employment at the Eagle Mine Superfund site. He reports episodic depression since his mid-30s. The objective screening revealed conjunctival and nail bed parlor, diffuse abdominal tenderness, but no evidence of trauma. Ray is stable with the following vital signs: a temperature of 98.8 degrees Fahrenheit, slightly tachycardic with a resting BPM of 110, but a regular heart rate. His respiratory rate is 22 breaths per minute. I'm going to start out with showing how the different symptoms correlate with the differential diagnosis that I chose. For example, small cell lung cancer has the symptoms of proximal generalized muscle weakness, periodic dyspnea, and fatigue. Here's the symptoms for asthma: iron deficiency anemia, COPD, and the most likely cadmium poisoning. Let's talk about cadmium poisoning for a moment. Generalized symptoms include aching pains in the back and the limbs, chills, myalgia, and generalized weakness. With chronic inhalation of cadmium, the patient could present with inflammation of the nose, pharynx, and larynx. This inflammation could result in shortness of breath. In the HEENT exam, you should be able to see a yellow fringe around the teeth termed cadmium ring. The labs I would order is the CDU, cadmium in urine. The normal urinary cadmium concentrations are less than 0.5 micrograms per gram of creatine. I would also order CDB, which is to test for elevated blood cadmium. Finally, I would use beta-2 microglobulin in the urine to see if the toxicity has started to cause renal tubular damage. So let's talk about some of the information deficits we had on this case. Starting with the history, we don't know the onset, the duration, or what makes his problems worse. Is there anything that helps his symptoms? How often does he have these symptoms, and what's the severity? Another question I would like to know is if the patient has a history of smoking. If he does, this could increase the chance that COPD could be the cause. What did the patient do at the Superfund site? Was he a worker that was in the mine, or was he just part of the admin that helped oversee the Superfund site? If he was a worker, was appropriate PPE used? PPE is the personal protective equipment. Also, I would like to know what the total dose of cadmium absorbed was. The blood and urine samples would help determine if it's been a recent exposure or a prolonged exposure. Is he still working at this site? And lastly, I would like to know what the patient's teeth look like. If he has a cadmium ring around his teeth, it could be a telltale sign of cadmium poisoning. So here are a few effects of cadmium on the body. Acute exposure could result in pneumonitis, which is the inflammation of the alveoli, which would cause the aforementioned shortness of breath. Chronic exposure would result in proteinuria, which is a sign of kidney damage. Free radicals formed by cadmium in the body would result in lung cancer. Osteomalacia will be discussed later in the case. Earlier we said that less than half of a microgram per gram of creatine was normal. If he was in the late stages of the toxicity, I would expect proteinuria and a greater than 15 microgram per gram of creatine. I'm going to talk about the pathophysiology behind cadmium and the effects on the body. I'm going to start out with the effects on the kidney. Proteins like ferritin, transferrin, albumin, and hemoglobin are involved in cadmium transport and excretion. Now here's the problem. Hemoglobin is being broken down by the spleen because it's bound to cadmium. This would result in hemolytic anemia. Looking at this chart, you can see that inhaled cadmium is deposited in the alveoli, and then it can be transported into erythrocytes, or it can bind to albumin proteins. Hepatic cadmium uptake induces the synthesis of metallothionein, which is a low molecular weight protein that binds cadmium to form the non-toxic CD-MT complexes. The CD-MT complex slowly is released back into the blood. Once in the kidney, the CD-MT complex is filtered through the glomeruli and taken up by renal proximal tubules. The complex is then degraded and it releases free cadmium, which will recombine with MT that is newly synthesized by tubular cells. When MT binding sites are saturated, the free cadmium in tubular cells remains and combines to form nephrotoxic CD fluoride and CD nitrate compounds, which are shown on the graph as toxicity. One more option that can happen is cadmium can inhibit the production of 1,25 dihydroxycalcitrol, which is vitamin D. Alterations in vitamin D metabolism can lead to osteoporosis, which is the bones becoming brittle and fragile, osteomalacia, which is the softening of the bones, or pseudofractures, which would be a result from osteoporosis. The last effect I want to talk about is zinc deficiency. So zinc deficiency is caused by cadmium competing with zinc for absorption at the enzyme binding sites. MT binds with CD preferentially over zinc, limiting the zinc transport into the tissues. Zinc-dependent enzyme activity of cells are then depleted. You might be wondering why zinc is important in the body. Zinc is needed for the immune system, and it plays a role in wound healing. There are other effects of cadmium poisoning: anemia and cardiovascular effects. There are three types of anemia that can be caused by cadmium poisoning. The three are hemolytic, iron deficiency, and renal anemia. Hemolytic anemia is caused by the destruction of erythrocytes in the spleen. Cadmium disrupts the efficient usage of iron in hemoglobin synthesis, so that would cause iron deficient anemia. Lastly, we have renal anemia. It's observed during the very late stage of chronic, severe cadmium poisoning. The effects of cadmium on the cardiovascular system isn't well documented in research, but research does show a correlation between cadmium poisoning and an increase in risk for atherosclerosis, and it's independently associated with MIs, myocardial infarcts. There are not many treatment options available for the patient, which is disappointing, but research has shown that high doses of vitamin D can decrease the effects of cadmium on the bones. Chelation therapy is another option. So what chelation therapy does is it binds cadmium through sulfhydryl groups to form stable covalent bonds that can then be excreted by the body. Diet and nutrition has been shown to decrease the effects of cadmium poisoning, but there was only one article that I could find that explained that. They were saying the increase of vitamin C and vitamin E, along with fruits and vegetables, could give you the nutrients to make metalloproteins that can take up the metals and then excrete them through the body. So what should be discussed? Now for the big question, what should we discuss with the patient? I would start off with treatment options, the risk of using chelation therapy, followed by the risk if chelation treatment was denied. I would follow that by discussing the proper PPE to use to prevent cadmium toxicity in the future. Finally, I would discuss with the patient how a healthy diet could help improve his condition. I'm going to finish with talking about the ethical issues in this case. There is no FDA-approved chelation therapy for cadmium toxicity. I would refer to a toxicologist to see if chelation therapy would be right for this patient. So, the difficulty for the patient to adapt to the new lifestyle and a change of diet. Although fresh fruits and vegetables and vitamins are expensive, it would be a lot cheaper than the chelation therapy. The last ethical issue I had didn't relate to the case, but I was wondering who would build a mine just upstream to a town with all the heavy metals being poured into the river. It would be going downstream into the tap water for the citizens of that town. There are severe ethical issues in that alone. I want to thank my audience and end with a question to think about. We know that chelation therapy has not been approved by the FDA for treatment of cadmium toxicity. My question follows: is it ethical to use chelation therapy even though it is not FDA approved? It can benefit the patient, but can also cause harm.